So, very good evening, dear colleagues. I am Dr. Subrata Chakrabarti, consultant endocrinologist, Medica Hospital, and Disan Hospital, Kolkata. So, I will be sharing with you some of the tidbits of the management of diabetes mellitus, busting some of the myths which a diabetic patient should know, and finally give a brief overview of the management of a patient with diabetes mellitus, which a doctor, a primary care physician, and a patient must know. Now, we should all understand that type 2 diabetes mellitus, there are primarily two types of diabetes mellitus, type 1 and type 2, and this we are more worried about this type 2 diabetes mellitus, which is an absolute pandemic in the 21st century. There are currently 300 million adults living with type 2 diabetes mellitus, and the number is expected to treble by the year 2045 until and unless urgent corrective and reformative steps are not taken. In the year 2015 alone, there were 1.6 million deaths, most of it arising due to the notorious macrovascular complication cardiovascular disease, as well as the equally notorious microvascular complication chronic kidney disease. So, blood glucose management is of paramount importance. So, in this regard, I would like to make you know that although China currently holds the numero uno position in having the most number of diabetics in the world, India is likely to topple China by the year 2045 and acquire the ignominious term diabetic capital in the world. So, starting with the management of diabetes mellitus, what should a patient know? So, we should all remember that the patient developing diabetes mellitus doesn't mean that he is bound to cut off all calories, he is bound to cut off all food, carbohydrate related food items. A balanced diet is of paramount importance. So the diet should be rich in proteins, the diet should be low in saturated fat but rich in polyunsaturated fats. He should be taking a healthy portion of whole grain bread, whole grain pasta, and a generous portion of fruits and vegetables. And along with this, the patient must undergo at least 150 minutes of brisk aerobic exercise daily, with at least 30 minutes of daily exercise daily, and no 2 consecutive days without exercises. So the patient must lead a relaxed and healthy lifestyle. As much as possible, we all understand this currently is the world of cutthroat competition, but still the patient should have a sound sleep of at least 8 hours in the night, and the patient, if possible, should perform at least 30 to 45 minutes of yoga or meditation, whatever the lifestyle suits. And finally, when does the patient understand that he is likely to develop diabetes mellitus? What are the early warning signs of diabetes mellitus? So, a patient must understand that if he or she is obese, if he or she has a first degree relative with diabetes mellitus, if he or she is coming from an ethnicity with high risk for diabetes mellitus, then he or she probably runs a higher risk of developing type 2 diabetes mellitus later on. Although those patients who have concomitant hypertension, dyslipidemia, and hyperuricemia and some manifestations of metabolic syndrome, these patients are also more predisposed to develop type 2 diabetes mellitus later in their lifetime. So this is all about type 2 diabetes mellitus. We are not really sure what lies the basis of the development of type 1 diabetes mellitus. Probably it's an admixture of genetic factors, probably it's an influence of the HLA related genes and some other unknown factors and undocumented factors, and some factors which are not clearly elucidated, at least in 2019. So what are the manifestations of a patient of diabetes mellitus? So classically, a patient with type 2 diabetes mellitus or type 1 diabetes mellitus would have the cardinal features of polyuria, polydipsia, and polyphagia, that is increased urination, increased appetite, and increased thirst. But the funny fact is that in spite of increased appetite, the patient undergoes weight loss. So that is a red flag sign in a patient with diabetes mellitus. So that should prompt the patient to make a visit to the physician, and that should prompt the physician to advise the patient to get a diabetic profile done. And finally, many patients, even at the first diagnosis of diabetes mellitus, has some sort of complications, which might be in the form of microvascular complications, which might be in the form of macrovascular complications. So, if the patient has got some sort of neuropathy, which is pretty common, at least 1 in 3 patients of diabetes mellitus run the risk of developing neuropathy sometimes during their lifetime. The patient would have some sort of tingling in their feet, a burning sensation, or a pricking sensation, or some electric shocks like sensation passing through the legs. If the patient is having nephropathy, so these patients might be noticing an increase or a decrease in the urine volume. The patient might be noticing puffiness of the face, mainly in the morning, or in some patients they might have some sort of swelling in the feet. And if the patient is unlucky enough to become a patient of diabetic retinopathy, and please remember this diabetic retinopathy is one of the leading causes of blindness throughout the world. He is likely to encounter some sort of visual problems like frequent change in glasses, curtain-like manifestations seeing in front of the eyes, or the patients with some sort of blurring or sudden loss of vision. So this is an alarming manifestation, because this is often a manifestation of tractional retinal detachment in advanced cases of diabetic retinopathy.